everybody, and thank you so much for joining us this afternoon for this final slot at the DMS Education Hub. If anybody would like a glass of Prosecco whilst we're sat here chattering, please feel free to help yourself. But hopefully what we're going to cover in the next sort of 25 minutes or so is to just take a little bit of a deep dive into the use of continuous glucose monitors in our veterinary patients, and in particular those ones with diabetes. So what we will cover in this short session this afternoon is, by the end you should hopefully be able to understand the principles of continuous glucose monitors, identify clinical advantages and also some of the limitations or maybe some of the troubleshooting that we might have with these devices, and then to apply your CGM technology effectively in both inpatient and outpatient care settings. Now, if we think about our patients, there's a number of different ways that we can measure glucose, and I guess these different options that we have are very much going to depend on the patient that we have in front of us in the clinic. It's going to depend on their history, and it's also going to depend on the information that we want, whether we want that information right here and right now, and so maybe more of a bedside spot testing type option. Now, the indirect options that we have for glucose monitoring will be things such as fructosamine, which we will submit and send often out to an external laboratory. There's a HbA1c, which is a glycated hemoglobin, which is used a lot more in human healthcare. And this is something which is used a lot in terms of, it will help kind of correlate between different things such as patients that maybe require dialysis, patients maybe at risk of a stroke event. And so that's used much more in a human healthcare setting compared to with our veterinary setting. We have, of course, got clinical signs also to help us with regards to kind of getting an idea about what our patient's glucose is doing. And then when we think about direct ways that we can measure blood glucose, this would this would be via a blood stick. So thinking about there doing our sort of spot testing, or it might be incorporated in your emergency database panel. We also have urine glucose that we can measure via dipsticks, and so this might be something certainly in our diabetic patients that we might be looking to incorporate in. And we've also then got interstitial glucose as well, which is what we're here to focus on this afternoon. Now, in terms of continuous glucose monitors, these are minimally invasive devices. So these are small devices which are attached to the patient, and usually they will then sit with a little probe in the interstitial space, and so they will then read interstitial glucose, and they will submit that glucose reading usually every kind of 1 to 5 minutes then through the sensor. And so what these continuous glucose monitors allow us to do is essentially to get much more in that moment, minute to minute information about our patient and their trending glucose. The other thing that they're going to help us to do is obviously then reduce the amount of times perhaps that we're going to be needle sticking this patient. So for me, certainly working in an ECC setting, dealing with quite a lot of kind of unstable diabetic patients, I feel very sad if I'm asked to do a needle stick every hour on my patient. So for me, then the fact that we can have this interstitial glucose monitor on means that my job is much nicer and my patient gets a much nicer experience in that hospital setting as well. And again, then what we will see is that these glucose monitors are linked then to apps, and so then we can use these apps to gain a whole heap of nice information, which then as a case vet you are able to use to help make decisions about then your ongoing treatment plan for that patient. Now, the way that these sensors work, and I've borrowed this picture from a very nice article that's referenced at the bottom in Vet Times, which Ian has written on glucose monitors. The way that these work is that they have this very small sensor, as we have said, which sits on the outside of that patient's skin, and we have this little platinum electrode which then is deployed through the skin, and it sits in that interstitial space. And so what we see is that we then end up with a glucose diffusion limiting membrane, which is around this little electrode, which contains glucose oxidase. And so what happens is, in the presence of oxygen and interstitial glucose, we get this oxidative process, which ultimately leads to then essentially the development of a current, and it's this current that's then proportional to the glucose concentration in the interstitial space, and it sends then that reading back up to the sensor. So very, very clever. Now, if we think about the history of these sorts of devices, they've been used quite a lot, obviously, in human healthcare settings for quite a while, really, now. So the first sensors that were originally developed were developed back in the 1970s to 1990s. And what they were used for was much more kind of for research purpose. So they weren't being really used clinically. These devices were much bigger. They often required a separate unit in which you had to scan that device. And what was also prevalent at that time was that there was quite a lag between the reading and what that patient was. By the time we got moved along in history to 1999, that's when the first commercial FDA-approved sensor was released for use in humans. And so again, these sensors worked where they would actually gain information, but more in a retrospective aspect for the previous 3 days, so they weren't being on patients for a long period of time. And then as time went by and technology evolved, by 2004, that's when we started to see then that we were getting more live in that moment results. And there was the integration of alarm systems, so building in hypo and hyperglycemic alerts. By 2012, they're then integrated into the use of smartphones. So we're starting to see then the use of apps again, so patients could access that information more freely. And again, with clinicians also accessing that information. And then by 2017, we've then seen that these human sensors have now become linked now to automated insulin delivery pumps. So that these people can now wear an insulin delivery pump along with their Freestyle Libre, for example, in the human healthcare setting, and it will deliver then based on the blood glucose reading of the monitor. By the 2020s, we've then got real-time access information, we've got much smarter technology, we've got much smaller profile devices, we have the use of AI coming in to these things, and again in human healthcare settings, we're even seeing, say, Bluetooth activated or insulin pens, as well as the pumps also being used. Now, in terms of our veterinary patients, kind of tried to have a little look back at when these first started to be used, and it was kind of around the about 2005-ish, they started to be used in veterinary care settings. But these devices, as we said, were much more primitive. You had to have a device that you scanned. There maybe was a time lag. And so I think it's nice to see today that we've come a very long way since then. Now, if we look at the use of these devices in a human healthcare setting, what we're seeing is that they're used predominantly for type 1 and type 2 diabetic patient management. And so these are allowing patients to be at home, going about day-to-day normal life, and these devices are going to help us to improve glucose control and reduce any hypoglycemic events, hopefully. There's also strong evidence base for trend-based decision-making and dosing with, as we said, now the integrated use of pumps or perhaps pens. And as we said, this is then going to probably, hopefully, improve with time and become more advanced as technology is evolving. And whilst we're here today thinking about the use of these devices in veterinary diabetic patients, it's also useful, I think, for us to think about other times when these might be used, and again, to reflect on human health care. So these devices are being used in ICUs and for critical care patients, so particularly maybe that might be thinking about unstable diabetic patients in a hospital setting. They're often used under anesthesia and surgery. For patients with cystic fibrosis, they can have often an earlier kind of pre-diabetic hyperglycemia kind of phase, and so they might be used as monitoring in that group of patients. Any patients with pancreatitis or kind of pancreatic disease, where we might see then insulin insufficiency, perhaps, where we can look at using these for monitoring blood glucose. Patients perhaps where we've got pregnancy or gestational diabetes. We see now also these are integrated into kind of lifestyle, almost blood glucose, interstitial glucose monitoring as well, with kind of people like athletes or people who are trying to, I guess, balance a nutritional way of managing their glucose. And again, any kind of patients then that are coming in where we're expecting to have an irregular glucose. So if we think about our veterinary patients, there's a whole group of patients on here which we might have in the hospital where actually they would also benefit from the use of these devices as part of their monitoring and their management whilst they're in that hospital setting. Now, in terms of our veterinary specific interstitial glucose monitors, it's great that we now have one which is available for us and our veterinary patients. And these differ a little bit from the human sensors because these are purpose made for veterinary patients. So these have been made to, I guess, tackle the fact that our patients are a bit hairier than most humans. And so if we've got hair growing back, these sensors will stay put as that hair starts to slowly grow back. These devices are then working off of algorithms and calibration, which is specific for the species that we are working with, for cats and dogs. So again, that is going to allow us to have alerts which are appropriate for our species, and these are trending up to higher blood glucose readings as well, as we will often see in our veterinary diabetics that we're dealing with, maybe certainly in those early stages, like really quite hyperglycemic patients, and this device will read up into sort of low 40s. So that's a definite positive. The other nice thing about this veterinary continuous glucose monitor is that we can also have with the app the integrated version of the client kind of facing version or side of the app, and then also the kind of other side of the app in which then the veterinary team can log in and access this. So the nice thing here is that multiple people in the practice can access that information. It's not limited to one device like we were 10, 15 years ago, and it was hard to access this information. So that's going to make it much nicer for the team to take a team approach at managing these patients. And again, there's customer support on offer from the team to help you out with these as you're hopefully getting them integrated in use in your clinic. Now, in terms of benefits to veterinary diabetic care, I think lots of benefits that we can see specifically in this group of patients. So hopefully going to improve safety as we're adjusting our insulin. So that might be as we're getting these patients stabilized shortly after diagnosis, or perhaps this is going to be maybe if we're thinking about then dose changing. We're going to have better detection of any of these low episodes that this patient might have. So we might have owners, and I think particularly as these patients are maybe newly diagnosed and the owner's trying to get their head around diabetes and management of diabetes, this can be quite scary. So actually being able to say to someone if the patient is acting a little strange and they're able to access what that interstitial glucose is, actually that can bring them some reassurance and some peace of mind. It's going to reduce stress and repeated blood sampling. So for me, that's going to make my day if I'm working with you as a vet and you say, actually, do you know what, we'll put one of these on because it means I'm not going to have to stick a needle in my patient every hour or two. It's going to help owners to feel empowered with at-home monitoring as well and get them on board with helping them to understand diabetes and understand diabetes in their pet. Again, it's going to allow us to access treatment effectiveness. So if we do have any of those dose changes, or perhaps we've modified the patient's diet, or maybe we've adjusted that patient's exercise, again, we're going to be able to then look at those certain things or lifestyle things alongside what that patient's blood glucose is doing. And it's going to help us to see again how those things are intertwined in affecting their glucose control. And again, if we have these patients where maybe we're not quite got them on the right dose of insulin and they're at risk of hyperglycemia, it is going to help us out in those patients as well. Now, in terms of your inpatients, because obviously if we think about our veterinary patients with our diabetics, it might be that we have them in the hospital for a brief period of time, but ultimately the aim is to then get them back to their home environment where we can then get them back to doing what they do normally and try and get them then into a nice routine and a nice rhythm. But we will have some patients obviously as inpatients whilst we're getting that initial bit maybe of stabilisation sorted. And so this is where it's going to be very helpful in those patients which maybe are unstable, or potentially if we have got that patient which is sort of the DKA. And again, it's going to allow us all those things that we've kind of talked about in that hospital setting. And ultimately what we want to try and aim to do is to reduce stress for that patient whilst they're with us in the clinic environment. And so really this is for me, I feel like it's a no-brainer. It's really going to help us to do that. And again, if we think about those other applications that we saw of where these devices are used in human healthcare settings, we said that many of these apply to our veterinary patients. So we will often use these on the sicker patient, whether they're with us in the clinic for diabetes or it's just part of their, problem list. What I would say about these is we just want to ideally make sure that patients are hydrated, because if they're dehydrated, we might get slightly squiffy correlation of numbers. In terms of anaesthesia and surgery, so we do quite a lot of eye surgery in the hospital where we work, and a lot of diabetic cataract surgery. So we would put one of these on the day or two before surgery, or get the owner even in this case to put them on. Then that patient can come in, and we've got a really good way of measuring their blood glucose in and around that surgery time, hospitalization itself. We also know with this group of patients, if they are diabetic and have a GA, they may have a period of instability after that general anesthetic. And so actually this will then allow ongoing monitoring at home in that period where we're then getting over that anesthetic and that stress of that hospital visit. Again, pancreatitis patients, or patients where we've perhaps got hypoglycemic type syndrome, so insulinoma type patients, for example, where you might be otherwise wanting to do regular blood sticking, and actually the continuous glucose monitor is going to allow us, then that's less needles for the patient. Now, in terms of your outpatient application, it will be once you've got that patient hopefully over their diabetic event in the hospital, we're going to get them to a point where they're going home. And as we've said, this is all about then this minimal stress. It's going to help you then as a vet to fine tune your treatment plan with that patient back in their home environment. As we said, adding in then these other lifestyle things that are happening, such as exercise, such as diet, and looking at how those things are affecting that patient, because obviously all of our patients are subtly slightly different. Now, in terms of placement and practical tips, what would say is these usually are needing to be on a fairly kind of flat area of the patient. So lateral thorax or dorsal neck, sometimes kind of up between the shoulder blades can be a good spot. But what we want to aim to do here is obviously clip a window of fur away, and then we will usually kind of give the skin a little wipe round with a bit of an alcohol swab just to get rid of any grease, and then we can attach it to that area. These Insight ones have come with a really nice sticky layer to put over the top, so I've got a little video on the next slide to show you. Sometimes patients might need a little bit of a light dressing just to cover it, or maybe a t-shirt if they're particularly wriggly squiggly. But I've had a couple of these that we've put on our neighbour's diabetic dog at home, and she's a really cheeky, in the video you'll see it, she's a really cheeky little border terrier, and she's done a lot of rolling around on her back on a gravel drive, and the sensor has stayed on. So I think with the sticky bit, it seems to keep them in situ really well. What we will just need to obviously do is counsel our owners. So just let them know with these sensors, that they are hopefully going to last about 10 to 14 days. Very occasionally we might lose one a little bit of time before, especially if that is a very, very active patient. And so just counselling them with regards to expectation. Other things then at the time of that placement that we can think about doing is to then talk that owner through the app if this is new to them and they're not sure how to use it. And we can then go through and set specific parameters for that patient and that specific clinical scenario. Now, to place them, as we said, we would want to carry out that patient preparation. So clip that sort of hair away, give that a wipe with an alcohol swab. And then as you'll see, you can open up your kit that you're using, take out all of the bits inside. And so this is one that we placed in a home setting. And you'll see that the device is very, very simple and easy to use. It's labeled with the steps. So following step number 1, step number 2, you're going to peel around the top and open it up. And then step number 3 is to then deploy the button inside. You're going to then twist off the bottom, and you'll see then that the sensor is loaded in the bottom here. So then to place it on the patient, this is Ruby, this cheeky little border terrier. She's got her little clip patch of hair all ready and prepped to go. And you're literally just going to push that sensor on, hold it there for a brief moment. So I think we counted to, probably you'll see on here, maybe count to about 10-15 seconds, just for that sticky glue to adhere to the skin. And then you can gently peel away your cartridge, and your little sensor will be then stuck to the skin. And as you'll see, they're very nice and low profile, and she barely even flinched. So really nice that it's not going to cause any discomfort at the time of placement. And then, as we said, if you apply that sticky dressing on the top, that's hopefully going to keep it really nice and secure, and it's going to last for that 10 to 14 day window and allow you then to keep an eye on what that interstitial glucose is doing. And so then that just sticks on the top and it's nice and secure. Now, in terms of then once that sensor's in situ, you would then scan your QR code on the box, which is then going to link it to your app, and multiple people can register to one sensor, so multiple family members can have access to that information. And as we said, there is the back on the other side of the app, which means you as a veterinary team have access also to that information and too. And so what we want to be doing with this information then is really focusing on what these trends are. And so there's a lot of information that you can get on that screen of the app. It's going to give you a glucose trend arrow, which is going to tell you in which direction things are going. As we said, you would then go through, you could set those alarms, which are specific for that individual patient for highs and lows. And it's going to allow you to track that information then really as a graph and as a trend over 24 to 72 hours. And the owner can then go into the app and add in these other lifestyle things. So they can add in if something was a bit different that day, or they can add in maybe what that patient was eating that day. And that's then going to give you more information to put alongside then what your interstitial glucose is. Now, if you're not using these in the clinic, then I would wholeheartedly advise you as a nurse working with these sorts of patients that are going to benefit from these sensors, advise you to take this conversation back into the clinic and to really consider your patients and where these can work for you as a team and for your clients. So review your caseload, think about those cases where they may be of a benefit, and then get some training on board. So think about training your nursing team and perhaps empowering those. This is a really nice nurse clinic that can be set up, and the nurse can work in conjunction with the vet team and actually get these, attached onto our owners. You can set that nurse clinic up and start to build that bond and that relationship with the owner, which is something that's very important with our diabetic patients who are going to be often coming in and out of the clinic and wanting ongoing advice and support. Again, write it all down in a standard operating procedure so you've got a fixed way of doing it and everyone's doing it the same way. And then you can look to use these shared digital dashboards, as we said, as a team to access that information and then make decisions for our patients together. In terms of things we want to just talk about with our client, as we said, we're going to want to counsel them as to the lifespan of those sensors. We're also going to want to sort of obviously explain the benefits of having this on. So that means for their patient less needle sticks, perhaps less physical trips into the veterinary clinic. There will be times where the owner still might need to do a blood spot glucose or maybe a urine dipstick, but those things, I guess, are going to be less frequent if we have one of these on. But just laying out those expectations for what we hope to achieve with that sensor in situ and how we hope it's going to benefit them and their pets. And again, perhaps providing some printed troubleshooting information, some troubleshooting information for the app as well. I think one thing we do just need to be mindful of is that some owners can get a little bit fixated sometimes that, when we get a new app and you're constantly looking at it and like, what's the number and is this... So again, I think this is where communication is key, and counselling them early on will hopefully avoid that. Now, in terms of troubleshooting, as we finish up, usually these sorts of devices will take a little bit of time to settle in. So around about 12 hours, you might find that you get slightly sort of irregular numbers for that first window. But after that, then hopefully what we're seeing is going to be representative. But it's important to remember there is a slight lag phase. So there is a 5 to 10 minute lag between interstitial glucose and blood glucose. We can occasionally get compression artifacts. We can see sometimes if the reading is off. So like if you're getting, like a really low reading and that patient is not presenting as hypoglycemic, then that would be where we would perhaps suggest, a spot check of a blood glucose to make a comparison. But remembering that actually those clinical signs, are part of our glucose monitoring as well as the physical, numbers that we're getting from our patients. As we said, sometimes these sensors will fall off because our pets lead quite active lives often. So particularly for those active dogs that are out and about on walks and getting up to mischief. So again, thinking about that patient as an individual and perhaps a little medical pet shirt might be useful so you can cover it and keep it in situ. And again, as we said, kind of just bringing owners, I guess, up to speed in terms of the cost and the learning curve. that these sensors coming in at approximately £60, but if that's saving that owner from perhaps making a trip into the vet or having to do regular blood glucoses, which is very stressful, I think that, certainly if it was me as an owner, that would be that would outweigh that cost for me. So it's going to come down to that owner. Now, in terms of, I guess, take homes, I think that these are going to be a really great option in our diabetic monitoring and management patients, both in the hospital and out of the hospital. They definitely are going to help reduce stress and improve safety. So for me as a nurse, I'm going to be advocating for these in the cases where they're going to be of a benefit. We know they're useful in the hospital setting and outside of that hospital setting. We know that these will and can be useful in cases and beyond just diabetic cases alone. And I think we're in for a very exciting time, because as AI is evolving and technology is improving, we're going to see that these devices are becoming probably much more smarter as time goes by. There's a few nice resources just up here, websites and things that I found that were useful along the way for preparing this presentation. And again, on some of these websites there's actually nice owner information as well as nice veterinary information for the team. Just want to say a big thank you to Woodley for sponsoring this session. You can of course go and see them and visit stand M04 or K30 to talk to them a little bit more about the Insight sensor. And Ian Ramsey is going to be giving a talk tomorrow at 12:30, which is in Gallery Suite 22, which is upstairs on the far side. And he has looked at a comparison of a Freestyle Libre and the Insight sensor on the same patients, and is going to be presenting that information tomorrow. So if this is something that is interesting for your clinic and something that's applicable for your patients, which I suspect you'll all see in diabetics, then please head to his session tomorrow to give some support and listen to what the findings are. Very happy to take any questions. Hello. So you don't have to scan this one at all. It's Bluetooth. So if the owner is in the close vicinity of the pet, then it will just send back every 3 minutes, I believe, to the app. And so they just have to be nearby, and then they can access information. So they would then, when you come back in, you would then get back into, But the Woodley team are all stood at the back here, and I will be very happy to answer like specific app-related questions. Hello. So that's probably a question for the Woodley team at the back. If the sensor fails very shortly after putting it on, do you have customer support available for that? And what happens in that situation?